Once again, good morning to everyone. In previous lecture, we were discussing about history and evolution of our medical surgical nursing. To continue with that, to discuss about the ancient world, so medicine in ancient world. So by the people, like first we came Egyptian, after that Greek people, Roman people. So accordingly, in ancient Egyptian people, it was a mixture of a common sense and magic, and people used to believe in sacrifice to God. They used to believe like if somebody is ill, so they used to believe that this person might have done any sin. After that, so ancient Greek people came. In that also, Hippocrates rejected all the magic and and he used to believe in herbal medicine, herbal medicines like any kind of leaves and other some herbal remedies. Aristotle thought the body is made up of a four humors. Humors are a liquid, that is a phlegm, blood, black bile, and yellow bile. And too much of humor or a liquid make person ill. So, and for the example, if any person is having fever, so fever have too much blood, so let him bleed. So he used to believe like that if somebody has fever and in this fever, according to his thought, there will be a too much of blood, so people used to bleed that people, so by that fever can be reduced. He used to believe this kind of misbelief. He established a medical school where the human body were dissected and gained better knowledge of anatomy. So he started one of the school, or where he used to treat the people for a human anatomy. After that, Roman people came. So in that, Galen believed that a theory of a four humors, which one that is for a phlegm, blood, black bile, and yellow bile. And Varro suggested that there are some tiny animal for a possession of a disease. Tiny animal in the sense like bacteria or some kind of. He believed that there are some kind of tiny animals like bacteria which are responsible for a possession of a disease. And Roman appreciated the importance of cleanliness. Uh, these were all about ancient world. If we see if we talk about the Middle Ages, somewhere in between 17th century. So in Middle Ages, medicine were dominant by the ideas of a Galen theory and theory of a four humors. That is a phlegm, blood, yellow and black bile. And Al-Razi was the first distinguish between smallpox and measles. So a barber surgeon emerged with the red and white stripes outside their shops and indicating the blood and bandages. And he used to treat some kind of operation. He used to perform some simple operations like setting the bone. If some person has break his or her bone, so he used to treat all this thing with the bandages, like settling the bone, pulling the teeth, and amputation. So by that time, this small and simple operation were done. Italian centurion invented a medical thermometer. Harvey realized that the heart is a pump. So heart is pumping, and by this pumping, blood is circulating throughout the body. Luigi Galvani discovered that the frog leg, which, if given an electric shock, shows that the electricity plays a part in a nervous system. So by that, it is invented. There is a electrical system in our body, like it is like a nervous system in which there are some electrical impulses which are present in our body. Different blood types were invented. So before that, nobody has invented different kind of blood types. So in Middle Ages, by the 17th century, different blood types were identified. Antibiotics were also discovered. Penicillin was the first discovery. So by that year, ancient time, and antibiotic were also invented. Father of Indian surgery. If we talk about the Indian surgery, one of our book, Sanskrit book, that is a Sushruta Samhita, is a most important book to learn all these things. The Sushruta Samhita is one of the most important surviving ancient treatises on a medicine, and it is considered as a foundation of a foundational text for a Ayurveda, which is a book of a Ayurveda, but it have so many treatises to treat the disease. The treatise address all the aspect of a general medicine, but the translator was G.D. Singhal because the Susruta Shahita was written in Sanskrit language. After that, G.D. Singhal has dubbed this Susruta Samhita, and he was known as a father of a surgery on account of extraordinary accurate and detailed accounts for a surgery to be found in the work. He has also been called as a first plastic surgeon. But, now let's talk about the trends in medical surgical nursing. Trend means any update or any changing, a general direction in which something developing or changing, that is called trend, or we can say fashion or a update, which is a positive change, we can say. So, trends in nursing. Recent trends affecting the nursing as a whole have also affected the medical surgical nursing, including expansion of advanced practice nursing. Nurses is now skilled in interviewing, observation, physical assessment, examination. So, nursing skill has improved totally, and because of that, there is improvement in total quality improvement, development in a clinical pathway, changes in a professional practice model to include greater number of a non-professional staff, increasing use of a nursing case management. By that, nursing nurses can manage all cases, and even she can work in a within her boundaries. Healthcare reform, in that over the years healthcare has become increasingly expensive. Insurance premiums have climbed. The trends toward the increased acuity of a patient began in the 1980s has become a fact of our life. If we see about the population changes, the nursing care requirement is increasing rapidly. Hospital service to elderly, and hospitals there are more elder people. Infected HIV people is also increasing. So day by day, even infected patients are also increasing with the HIV. And one more trend is there, that is the computerization. So now nowadays we can see that everything is going digitalized. So even in hospital also, nurses and other staff used to manage all these patient details in their laptops or tablets, so we can get that data easily. Use of a computerized record, using computers in many ways to ordering supply, immediate access to the diagnostic test and result, even for a medicine or any kind of report. Everything is a computerized. Developing individualized plan of care. Even in trend, there is a evidence based practice, which is actually which become evidence for nursing practice to improve a care, to achieve a client outcome, to get best possible outcome. Evidence based practice is followed by the nurses. Ethical concern. Nurse should be aware of a right of a patient and different ethics. So here we are done with the nursing trends, and if we see the nursing specialty, there are so many department were established like ambulatory care nurse, peri-anesthesia nurse, cardiac or a vascular nurse, critical care nurse, emergency nurse, flight nurse, dialysis nurse, first assistant nurse, holistic nurse, home health nurse, nursing administration, school nurse. So according to department, these specialties were identified. Masters in higher degree in nurses. For that also, nursing practitioner course were established like acute care. nursing practitioner, adult care nurse practitioner, family nurse practitioner, gerontological nurse practitioner, palliative care nurse practitioner, and pediatric. And uh, along with all this specialty, there are some more specialities are also there, like geriatric nurse, etc. Clinical specialist like adult psychiatric and mental health nursing, community health nursing, medical surgical nursing, palliative and pediatric nursing. These are some of the specialties in nursing. Others like advanced nursing administration, like it is included for a managerial activities of a nurse. Advanced oncological clinical specialist, clinical nurse leader. So these are some specialities. Hope you guys understand all these things. Thank you.